All right, I'm Dr. Pat from PT Made Simple, and today we're going to talk about the difference between a shoulder replacement and reverse total shoulder replacement. So to do that, first we're going to talk a little bit about just basic shoulder anatomy. So the shoulder is a ball and socket joint. You have your shoulder blade or your scapula, and then you have your humerus or your arm bone. So when you talk about a shoulder replacement, what they do is you have your ball right here and then your socket right there. Think of a golf ball on a golf tee. So when they replace the shoulder, first we can talk a little bit about reasons why you would have a shoulder replacement. The big one being if you have really bad shoulder arthritis. You would usually see that on an x-ray. You have limited range of motion, pain, sometimes clicking, crepitus when you're moving the arm. So if you needed a shoulder replacement, what they would do is they would replace the ball and then you would get a new socket as well too. So you get a new golf ball and you get a new golf tee, and then it's kind of anchored down into the further down into the arm bone there. So that would be just a regular standard shoulder replacement. You still keep the same basic anatomy. You still have kind of the golf ball and the golf tee. You just replace the golf ball and you replace the golf tee, the inside part of that shoulder blade. Now, for a reverse total shoulder, first we'll talk about why you would have a reverse total shoulder compared to a regular total shoulder. Well, obviously it comes along if you have bad arthritis, again, just as in a regular shoulder replacement. But what the difference is with this is if you have severe rotator cuff tears and your rotator cuff is pretty much gone, then what they have to do instead of doing a regular shoulder replacement, they have to do a reverse total shoulder replacement. So again, going back to the basic anatomy where you have the golf tee, shoulder blade, and then the golf ball, the arm bone, and a regular shoulder replacement we just talked about, they replace the golf ball and they replace the golf tee. And reverse total shoulder, what they do is they reverse the ball and the socket. The socket becomes the ball becomes, or the socket becomes the ball becomes the socket. Or said otherwise, the golf tee becomes a golf ball, the golf ball becomes a golf tee. So what they do is now when it comes up, the arm bone becomes the socket, and then the shoulder blade becomes the ball. So the big difference for this is you can see that's why they call it reverse, because the golf ball is now the golf tee, and the golf tee is now the golf ball. So that's why I call it a reverse total shoulder replacement. And again, the reason why they do this is if you have a lot of damage to your rotator cuff, the rotator cuff is damaged. Similar outcomes you would expect between a regular shoulder replacement and a reverse total shoulder replacement. The big difference is here, when you have a regular shoulder replacement, the rotator cuff is still functioning to initiate movement and move the arm. But if the rotator cuff is badly torn and you have a reverse total shoulder, what they do now is you have your deltoid muscle, your big shoulder muscle that comes over the arm. That is now the primary mover of the arm. So you rely on that to move the arm instead of the rotator cuff because it's torn. So that's why you have to do a reverse total shoulder. So when you're going to physical therapy, they focus a lot on deltoid exercises to initiate motion and get the movement back in the arm. So that's a little bit about the difference between a shoulder replacement and reverse total shoulder replacement. If you have any questions or is there any other topics you'd like to discuss or have any questions about, Leave a comment down below, or you can always send an email to ptmadesimple@gmail.com. So, thanks for watching.